Welcome to BPS Live. My name is Steve Ronan from Blackhawk Plastic Surgery. Tonight's show is going to be a little bit different. Instead of doing a particular procedure, we're going to go through our consultation process from the first time you call us all the way through surgery. And because of that, tonight I have both my patient coordinators, Brette and Teresa, to help me out with tonight's show.
Thanks, Dr. Ronan. I'm so excited to be back. This is my counterpart, Teresa.
Excited to be here tonight.
We're here to share information about the consultation process and what BPS Live does for you guys. We send out clips of our show, lots of information that we put together for you guys. I'm so excited to be back and share the consultation process with you.
Brette and Teresa will guide you through your consultation process from the first time you call us or connect with us through the internet. They'll be talking to you, doing a pre-call with you before you get here, send you copies of our videos so you can be very familiar with what's going to happen when you come in for your consultation. So patient journeys usually begin at home on their phone or their computer, and they'll be searching for information and oftentimes contact us either by phone or through our website or however they may come to us. And so one of the first things they'll do is have a phone call with one of our coordinators. Teresa, typically how does that go? What do you guys cover?
So usually I'll take the phone call and get to know you a little bit, gather some information you might be interested in talking about with the doctor, maybe give you some pricing if that's something you'd like over the phone as well. Go through the process of when you come in and you meet with Dr. Ronan and how he will go through the surgery more with you. And I'll also talk to you a little bit about financing if that's something you're interested in. And we have links we can send. And then at that time, I can send you videos of what Dr. Ronan and Brette have talked about in the past. And we find that that's super helpful to kind of get to know you more. And when you come in, you kind of have a name and you're more familiar with the practice.
So Teresa, maybe you could tell us what happens when a patient comes into the office, checks in. What's the process that they're going to go through during their visit?
So when you first come in the practice, you're going to meet with our front coordinators. They're going to help you give you a little paperwork to fill out so we can know a little bit more about you when the doctor meets with you. Then Brette or myself will come out and greet you and take you to a really nice consultation room. It's nice because you can bring a friend or your husband or a partner with you, which is great when they can be around the doctor as well. And at that time, I'll talk to you and Brette will speak with you about things that we talked about on the phone and see if there's anything else you'd like to discuss with the doctor. And then we go get Dr. Ronan and he comes in and does his magic.
So during the consultation, I'll come in at that point and then I'll ask you what are the things you want to work on as opposed to what procedures you want. So we'll talk about what are your goals and what do you like and not like and what do you want to change. And then from that, in your examination, we're going to come up with a plan, which we'll review with you and pick out the best course of action to get you your intended result. And so at that point, I'll leave and then you guys will finish up. So how does that process go, Brette?
Well, because we're in the room with you and listening to the plan and putting together different options, if that's appropriate, I come back in and go over pricing. We go over financing options. We go over scheduling, and we talk about everything to get you scheduled or just answer more questions if you forgot to ask the doctor something. It's easygoing. We're super, friendly, I hope, but easygoing, and we just want to help walk you through the process. So he's gone over everything. We get to finalize the consultation with you that day. So
that's super helpful. And on the financing part, which I really don't have anything to do with, they sort of handle. Brette, I'm wondering, how does that go for patients? What's the process for them? Does it impact their credit or not, that check? And is it really painful or easy, or how does it go?
Super easy, actually. We use a company called PatientFi, and they're the main one that we use. We love them. Usually when I am talking to a patient, I'll text you a link when you first, kind of a welcome link. It does include a financing link so you can get pre-approved before you even walk in the door. We also have QR codes here where you can scan them and sign them. It takes really, doctor, in like 2 minutes. It's so easy for the patient to get pre-qualified. It is a soft credit check, which is nice. So it doesn't impact your credit score. And then they have lots of plans. I know a lot of patients really like a 0% interest, which we do offer. So I'm happy to talk to you more about it.
So one thing about Blackhawk Plastic Surgery is we're designed to be flexible. So we operate every single day at 6 a.m. So there's surgery every single day. So it's not just 1 or 2 or 3 days a week. It's every single day is available. And we do that on purpose so that we can be maximally flexible to fit our patient schedules. And in general, our schedule will reflect the needs of our patients. So on bank holidays and days when you guys will have off, we're often at work because it's more convenient for you. And so that also includes times of the year where you have lots of time off. Maybe at the end of the year, we're super busy because we'll be doing a ton of surgery because, you guys will have more time off and it helps you guys recover.
And I like to always say to patients too, we have our own anesthesia team. We have our own nursing staff back there. Like you said, we're made to be flexible. We might do 1, 2, or 3 surgeries a day. So it's easygoing, and scheduling is a breeze. We schedule pre-op a couple weeks before the surgery. So we try to be flexible, just like you said.
One of the questions we get is for a patient who perhaps lost a bunch of weight with the GLPs or some other fashion, and they'll have really a number of things they want to do on maybe breast, body, and face. And so it'll be too much to do at one time. And so we might make a plan that involves 2 different days in the OR. And so if so, we'll figure out how we're going to stack that. It might be even 3 or 4 weeks apart, but we'll pair them up so that they'll fit logically, both in how we're going to do the procedure and then in your recovery to make it the most efficient possible for you. So let's talk about the pre-op appointment. So someone has scheduled their surgery, and typically around 2 weeks ahead of time, we'll schedule a pre-op appointment. Teresa, do you want to talk about how that goes or what we accomplished during that appointment?
Yeah, so we schedule that appointment for you. Usually when we're looking at dates for you, and when you decide you want a date, we set that up for you. And at that appointment, you're going to come in and you're going to fill out some paperwork, which you'll get copies of everything. And it's a training booklet, just so you kind of have information about what to expect during recovery, even how you're going to feel during the process of it. We have a little page in the back that kind of tells you the emotions you go through with it. And at that time, the nurse will take you back and you'll meet with her, and she'll do your vitals, go through medications with you, send in prescriptions. And they're really knowledgeable. They're back in surgery with Dr. Ronan very often, so they have a lot of great information. And Dr. Ronan will come in and speak with you again in case you have additional questions. And then I'll meet with you again to set up your post-op appointment, and we do your surgery payment at that time.
So the pre-op appointment's pretty thorough. It's typically about 1.5 hours to 2 hours. It can be shorter, but sometimes patients have really a lot of questions. And so we make sure we go over that in really great detail and all of the instructions. And again, you go home with a pretty fat book about the whole thing. And so if you have questions when you get home, of course we're here, but it's likely to be in all of your paperwork because we've really anticipated a lot of these questions. And so all that information will be waiting for you and typically in the book you go home with. There are some people that read every single word and have questions about all of it. And there's others that probably breeze through it and don't look at it as carefully. But we make sure everybody really has an understanding of the process and what's going on. And that's kind of why these appointments oftentimes take a little while. So we try to be very thorough, and that is the preparation for you going into the surgery. And so then after doing all of that teaching, the morning before your surgery, we'll review things again. And then after your surgery, with whoever's going to be taking care of you, we'll review it again with them as well. And so we find when we do this, patients are pretty comfortable when they get home and they're able to handle everything. The other thing that we do is we try to make the process as simple as possible. So almost all of our sutures are dissolving. We don't use drains very often. And so there's not that much to do after. It's more like just curtailing your activities and potentially treating your skin if you had laser with some ointments. But by and large, it's mostly just kind of taking it easy and letting it heal. So Brette, maybe you could talk a little bit about when we complete the surgery and the patient's woken up, which usually happens pretty quickly. And then we bring the significant other or family member or the caretaker back to see the patient.
Yeah, happy to. So when the patient is here for surgery, one of our nurses will talk to their caregiver, their loved one, whoever's picking them up that day, and go over some instructions. When the patient's awake, they'll have them come back and see the patient at the bedside and go over some discharge instructions and just familiarize them with what to expect. Sometimes patients walk out of here. Sometimes they might need some assistance out to the car. We try to make it a pretty easy process for you during discharge after surgery.
So we can talk a little bit about the recovery process. We have videos for different procedures where you can get a little more specific answer, but just in general, if you do a face, like the whole face, most people are back in public within 2 weeks. In a month, they would be ready to go to a wedding and have pictures taken of them, could start low impact aerobics, and probably not lift anything heavy or strained for about 2 months. We also do a lot of really large body procedures, maybe a tummy tuck, lower body lift, with some sort of breast procedure. And so that really has a similar timeline with returning to work in about 2 weeks, working from home, obviously very quickly, low impact aerobics in about a month, and not straining for 2 months. And so they're similar. Face is quite a bit easier to do than a big body procedure. But we do have a couple things that can enhance the recovery, decrease risks, and perhaps speed things up a little bit. And one of those things would be our hyperbaric chamber. And so we can do what's called a dive, or put you under hyperbaric oxygen therapy, where you're put under, as if you were diving, you're under increased pressure with a high percent of oxygen. And so that really forces oxygen into your tissues. And it does things like it helps prevent infection or treat bad infections. It also helps with the healing of your flaps. It brings more oxygen supply to them, which helps them heal quicker. And if you had an area that was kind of struggling, it can kind of really turbocharge that area and get it healing better. And so that's just one of the things that we try to do to make the process as easy as possible. You don't have to do hyperbaric oxygen therapy, but it likely will increase your safety margin and probably speed up your healing process a little bit. Teresa, perhaps you could discuss what happens when you go home from surgery. You get home, and how do you communicate with our office, and what do you communicate about?
Yeah, so you'll get home and rest a little while, and then in the afternoon, one of the nurses will call and check on you and see how you're doing, check on how you're feeling, if you need anything or have any questions. Then the next morning, you'll probably hear from them again. Usually it depends on how big of a surgery you've had. If you've had a tummy tuck, lower body lift, those kinds of things, you might have more check-ins from them that week. And then we see you on the week post-op, 7 days later, and you'll meet with Dr. Ronan, and he'll check and see how everything's healing. And the nurse will also come in and also meet with you and see if you need anything. With our faces, sometimes we're starting you on some skincare at that time. And then after that, we set up, if you haven't set it up already, we set up your 3-week later one, and at that time, you'll come back at that time as well. Your first post-op will be a little longer because we're going to go over things and really check in with you and see how you're feeling. So after post-ops, if for some reason you need to reach us or you have a concern, we would love it if you just reach out to us. We're here for you. Our main thing is you as a patient. And a lot of times nothing's wrong, but sometimes if something just doesn't feel right, we want to see you. So call us. We're going to schedule you. We're going to get you in and help you feel relaxed and comfortable and know that we are here for you.
Thanks for tuning in to BPS Live tonight. We had fun talking about consultations. We would love to see you. Please feel welcome to join us here at Blackhawk Plastic Surgery. We have about a 14,000 square foot facility with multiple ORs, recovery beds, a full Medi-Spa, tons of technology, all sitting, waiting here for you. Brette, maybe you could tell everybody how to get in touch with us.
Yeah, of course. You can schedule a complimentary in-office consultation with us. There's a QR code on screen for you. You can also visit our website at blackhawkplasticsurgery.com. Call the office, 925-736-5757. You can email Teresa and I at info@blackhawkplasticsurgery.com.
Thanks for tuning in tonight. We'll see you next time on BPS Live.
Bye, guys.
Bye, guys.